Good afternoon. I'm Sarah Jane from the University of Liverpool Radiotherapy team, and I'm going to talk about our experience of running extended simulated radiotherapy placements. We recently conducted a project to evaluate a unique integrated 2-week radiotherapy simulation placement. Our students were randomized into either simulated or clinical placement cohorts, and clinical skills were compared in a blinded independent practical assessment. We've recently published findings from this study which demonstrated equivalence of student performance and also a statistically significant improvement in interpersonal skills for the simulation group. In this presentation, I'll aim to share some details of our simulation resources and also think about the logistical challenges of implementation and our plans for using simulation to support student learning through COVID-19 restrictions. The project began with development of the Liverpool Radiotherapy Simulation Centre. We already had VERT and treatment planning software, and we added a range of other equipment, including a mobilisation kit, a mould room couch and water bath, and patient trolleys, etc. We have access to our own CT scanner, which was used for pre-treatment simulation activities. A large part of our planning involved development of small group activities that would replicate the clinical workflow in a radiotherapy department. We developed a code of conduct for the simulation facility as we wanted students to treat it in the same way as a clinical department and observe professional conduct, wearing of uniforms and timekeeping, etc. We also developed a student handbook with a guide to the timetable of activities, with space for students to make their own notes and reflections. There was a staff version of this detailing relevant learning outcomes and facilitation information. We compiled patient notes based on real cases to demonstrate a variety of cases, such as breast, head and neck, prostate, and palliative lung. We booked actors to portray these patients and liaised and met with the actors to run an introduction to radiotherapy session so that they could understand what to expect as a patient. Some of them had experience acting for training medics, and we worked with each actor to do role development and match them to a set of patient notes. We did risk assessments related to the use of equipment and students handling the actors for positioning purposes. We also used hospital branding throughout all of our resources and documentation to give the facility an identity and make it feel more realistic as a clinical site for students. I've included this slide as this was the activity which the students indicated was their most highly valued. We ran scenarios where the students interacted with and positioned an actor patient on a couch positioned in front of VERT, which you can see in the attached photo. The students then communicated with the patient and set up the appropriate technique using VERT. We found from looking at some previous radiotherapy simulation studies that many commented on the difficulty in using VERT and combining that with patient interaction. So we wanted to achieve that combination of technical and interpersonal skills development and felt this setup was really useful to students. And as I say, they rated it really highly in their feedback. It was challenging developing activities to cover 2 weeks of simulation for our students, and we very much adapted the approach we used for this initial project. Simulation placement is now more embedded within our standard teaching delivery. We realise the importance of ensuring the learning outcomes are met, but also maintaining a clear focus on student priorities and thinking about what their specific concerns are related to clinical. You can then spend the majority of the time on these high value activities, such as the patient interaction and setups that I've just mentioned. It's a real team effort running these extended placements, so engaging colleagues and ensuring sufficient facilitator numbers is really important. Allocation of time to each activity can be tricky because it can take more or less time than expected. So you need to ensure you've got backup activities and also sufficient time for debriefing and feedback. We've been lucky with our actor engagement, and I think allowing time for actor preparation is essential for parity of experience. There were occasions where the actors could get a little more carried away with the scenario, so knowing the limits of what you want them to depict and what you want the students to experience is key. The handbooks were also really useful for preparing the students and as a guide for the facilitators too. And it also really helped us to adapt our processes after the first iteration of such a long placement. There are logistical challenges of planning equivalent activities to placement and ensuring students get sufficient time to engage with each activity. Also, planning simultaneous activities to ensure groups within the cohort are adequately occupied during parallel sessions can be challenging. There is expense involved, although high fidelity is not always necessary to achieve simulation. There are some costs related to consumables, etc. For instance, if you're using thermoplastic masks and things like the current considerations for PPE. It's also very resource intensive. It takes a lot of time for academics and for actors. We have done some simulations using peer involvement where peers from other years acted as the patient, and this is a consideration if you don't want to have that outlay on using actors. We're currently developing our plans to run simulations with students in the new academic year. Obviously, we've much greater restrictions on numbers now, but we found that these small groups actually result in really high quality interactions, which give our students a real opportunity to learn and help us get to know them better and develop good learning partnerships with them. We're looking to provide weekly simulation activities and allow some on campus time for our students so that they can benefit from simulation and feel connected with the course, their peers, and the lecturers. We found this particularly important for new first year students as it helps to prepare them for the clinical environment and then offer them an optimised experience when they do go out into the clinical situation. We're planning to integrate more COVID related teaching such as PPE awareness and consideration of trust protocols. And we're hoping this will aid retention and be attractive to those enrolling on courses and potentially avoid some of the deferrals that have been spoken about. I'd like to acknowledge the input of all of the radiotherapy team in all of our simulation activities, and also the Office for Students, the School of Health Sciences, and Virtual for their financial and logistical support. Thank you.